based on the track record of the previous lending that's been done by the credit unions, and this is one opportunity that we should be able to have in making sure that small businesses have the access to capital that will allow them to continue. So, Mr. President, I yield the floor.
Mr. President.
Senator from Louisiana is recognized.
Mr. President, I thank the senators for their discussion of that amendment. I have submitted to the record Senator Johnson, who is the chairman of the Banking Committee, his opposition. And I would like, before the senator leaves, just to correct one thing for the record. I, as the manager of the Small Business Innovation Jobs Bill, which you were so helpful to us in passing, we did ask the credit unions if they wanted to be a part of that lending program, and they declined to participate. So I just wanted, for the record, to be clear that, you know, I do know, and let me just speak for myself, that credit unions serve a valuable role in our nation today, and we want to acknowledge that. But I did want the senator from Colorado to know that according to the information that I've been given, they were asked if they wanted to participate in the Small Business Lending Fund, and they declined. They may change their mind later, and we could amend that program should they decide. But I thank the senator for his comments. I see the senator from Georgia, so I'll yield back the time. I think he wants to speak on a different amendment, but that is what the purpose of this morning's discussion is about. And I yield the floor.
I thank the distinguished senator from Louisiana.
Senior senator from Georgia is recognized.
Thank you, Mr. President. I look forward to being in New Orleans this weekend, by the way, I might add. So it's a great state and a great city. There is a pending amendment by Senator Hutchinson dealing with medical waivers, which prompts me to come to the floor for just a minute and talk about that issue as affecting Georgia today, and in particular talk about it in the context of what our governor and our legislature are having to deal with right now in terms of the mandates of the health care bill signed on March 23rd of last year by President Obama. In fact, on the signing of that bill, there were a couple statements I reflect back on those long debates, which I'd like to repeat right now. One was Speaker Pelosi saying about a month before the House passed the health care bill that you had to pass it to find out what's in it. That was a funny statement at the time, but it became prophetic today as we're beginning to discover over and over again the unintended consequences of the legislation on our states and on medicine. Secondly, Vice President Biden declared the magnitude of the impact of the health care bill. That magnitude is turning out to be higher cost, less benefit, and more regulation on our states. In Georgia in particular, and I just want to bring these 2 points up to talk why this whole issue of medical waivers is so important. Our insurance commissioner, Ralph Hudgens, has submitted a waiver to CMS for a waiver on the medical cost benefit rule in terms of benefits paid on policies, taking it up to 85%. That mandate in the health care bill is going to force not better coverage, but less coverage of our insurance companies in Georgia because they'll leave because they can't meet it. It's the intention to regulate the amount of benefits that's paid. The application means companies that can't meet it by the time set in the bill will leave the state. So instead, you have less of what was promised rather than more. You have less available choice and more people forced to a single-payer system in the government operated through an exchange, which prompts me to the second issue that's going on in Georgia. Our newly elected governor, Governor Nathan Deal, is trying to deal with a mandate on setting up the state exchange, trying to set up an exchange that will be available to operate by 2014 in a period of time where the public wants no part of the national health care bill and wants to wait on a Supreme Court ruling on Judge Benson's opinion in Florida. So I come to the floor to say these medical waivers are important. States are having to ask for them because of the impact of the overall health care bill that was signed on March the 23rd of last year. And if some relief doesn't come, we're going to have some cataclysmic events. One of them will be the impact on employees in small businesses, which is what this bill is all about. And I ran a small business. And I had independent contractors for whom under ERISA you cannot provide health insurance. I tried my best to get this Congress and this President to consider a associated benefit program approval so we could have people in like professions assemble together, form large risk pools so they could compete for insurance like major companies and states do. That was rejected instead for an exchange and for a simple system that says small business must provide health insurance to their employees, but if they don't provide it, they'll pay a modest fine that's much less than the cost of the insurance. That one statement and rule alone forces people in small business to leave, health care coverage from an insurance cover that gets it through their employer, and instead they have to force to go to a government exchange where choice is limited and mandates are many. So I just want to commend the distinguished chairman of small business and the ranking member of small business for the effort they're making on this bill, but also commend Senator Hutchinson on the importance of us considering the volume of these waivers that are being filed, why are they being filed, and they are an early warning for what's going to happen to us when this bill goes into effect if we don't take the Obamacare legislation and commit drastic surgery, or better yet, start over and build a system that works where we have the private delivery of health care and a minimum of government interference. And I thank very much the chairman for giving me the time to speak.
Mr. President,
Senator from Louisiana.
I thank the chairman, I thank the senator from Georgia for coming to the floor and participating in the debate. I have a different view on the amendment that he spoke on, but we will continue that debate, and in fact debated health care policy in this country for the last 2 years. And while I appreciate his views, I'm hoping that we could keep the debate very, very focused and specific if possible. But I understand that this amendment of Senator Hutchinson's and the amendment that Senator Isaacson supports does affect small business, so we look forward to more comments as we go forward. I wanted, Mr. President, as we wait to move to the CR, which under unanimous consent I think we're moving to in a few moments, so we'll be off of the debate on this bill, just to submit for the record some of the data associated with job creation. I know that Senator Snowe is very, very sincere in her comments about the lack of job creation in the country, and I want to say that I agree with everything that she said in terms of the rates of unemployment are very, very concerning, and that's why she and I have spent so much time on the committee trying to look at the array of bills that we have, at least in our jurisdiction, to see what we can do to help change the outlook. And I'm very proud to say that I think that we have, in large measure, contributed in a positive way. But just for the record, in terms of job numbers, because I don't think that President Obama and his administration get the kind of credit sometimes that I think they deserve. And frankly, that the Democratic leadership sometimes doesn't get the credit that it deserves for turning around a really desperate situation. And I'm going to submit these numbers to the record, but I'm also going to have a chart later, because I just think it's important for people to understand. And I want to just throw a few of these numbers out, and I'm sorry I don't have this chart clearly produced at this point, but I'm just going to give you a couple of numbers. In January of 2009, this country lost 820,000 jobs in that 1 month. In that 1 month, we lost more jobs, according to this document that I'm looking at, probably in the last, I don't know, last 10 or 15 years. I'm going to go back to Chet. I'm sorry. Can I have one more minute?
Yes. Without objection.
I don't see Senator Inouye. I'm just going to ask for actually 2 or 3 more minutes till he gets to the floor. That is the highest number of job loss in years, and I'm going to tell you how many when I find out exactly. The point is, President Obama was not the president in January of 2009, or he was just sworn in 2009. He was elected in 2008. So the job losses of the year before, which started February of 2008, which was the beginning of the recession, before President Obama was sworn in, we lost 83,000 jobs. In March, 72,000. In April, 185. In May, 230. In June, 178. In July, 238. In August, 267. In September, 434. In October, 509. In November, 802. And December, 619. And then in January, the month he got sworn in, we lost 820. Now, I understand people have different views, but to blame a president who wasn't even in office for this recession is wrong and it's not fair. And that often happens. It doesn't happen from our ranking member, but it does happen from others around here. In addition, that terrible loss of jobs continued as Wall Street collapsed, fat cats ran off with the money, people's Social Security and 401ks, well, 401ks, not Social Security, thank goodness, but 401ks tanked, public pension funds that people are screaming about, that something's wrong with them. Yes, there's a lot of things wrong with them. The Wall Street collapse of greed, unparalleled maybe in the history of this nation, sunk so many of our public pension funds, not the fault necessarily of governors or legislators or employees themselves, and there are some underfunding opportunity. I was state treasurer. I know something actually about this. But the big culprit was the collapse of the market, which was started before this administration. These numbers continue, 500, 300. And what's happening this year, 2010, is it's starting to reverse. Yes, ma'am, it is starting to reverse. In March, a plus of 192. In April, a plus of 277. In May, a plus of 458. In October, a plus of 171. And I could go on. The point is that, you know, it's not all gloom and doom. There are some things that are working. We need to keep working together. That's why Senator Snowe and I are on the floor, and I see Senator Inouye coming, and it's time to go to the CR. But we are working together the way our committee has had a tradition of working to try to take a bill here, a bill there, putting good programs in place, putting new ideas, thinking outside of the box, because we all have to do the best we can to get this economy moving again. So I just wanted to say for the record to submit this data. I see the chairman of the Appropriations Committee, and I believe at this time, Madam President, I will yield the floor and proceed to the next order of business.
Under the previous order, the Senate will proceed to the consideration of H.J. Resolution 48, which the clerk will report.
Calendar number 20, House Joint Resolution 48, making further continuing appropriations for fiscal year 2011 and for other purposes.
Under the previous order, there will be 3 hours of debate equally divided between the leaders or their designees.
Madam President.
The Senator from Hawaii.
Madam President, I rise to discuss House Joint Resolution 48, a short-term continuing resolution designed to keep the government open through April 8th. If the Senate passes the resolution, it will be the 6th, and I repeat, 6th short-term CR this year. With this passage, we'll be more than halfway through the fiscal year, and we're still operating without a budget. H.J. Res. 48 would fund the government for an additional 3 weeks and will reduce the rate of operations for the federal government by an additional $6 billion. If adopted, we would be operating the government at a rate that is $51 billion below the amount requested by the administration for this fiscal year. At this level, our spending on security programs will be $30 billion below the President's request and $21 billion lower on domestic spending. Madam President, I would also point out to my colleagues that this is $31 billion below the so-called Sessions-McCaskill level, which every member of the Republican caucus voted for last year. The aggregate amount in this short-term CR is the level proposed by the President as a compromise with the House Republicans, and it's the same amount that was included in an amendment which I offered as an alternative to the House CR last week. By agreeing to this level, the Senate will be $6 billion lower than current spending levels, but no lower than the President has recommended. While several of my colleagues have complained that we simply have not cut enough government spending, most of our subcommittee chairmen and many members of the Democratic caucus are beginning to think that we've already cut too much. I believe the disparity in views can be partially explained by the information described below. Recently, the Center on Budget and Policy Priorities released a report which notes that in comparing appropriations funding levels, the appropriate measurement should be expressed in inflation-adjusted dollars, normally referred to as real growth. The center's point is that the cost of government operation increases each year by inflation. One cannot ignore the fact that if the price of goods and services rise by 1, 2, or 3%, the federal government's cost in providing these goods and services will also increase by this rate. When we fail to consider the effect of inflation on federal discretionary spending in viewing spending rates, we are not accurately reflecting what it costs to run the government. If utility prices are increasing by 5%, and if we don't budget the extra amount, we are forcing to cut other programs to pay for the fact-of-life increase in our utility bills. Longevity increases paid to civil servants and military pay raises are also fact-of-life increases that we cannot ignore. These bills have to be paid even if we aren't budgeting for the increased costs. And if we are not basing our funding decisions on real costs, adjusted by inflation, we're in fact forcing government to cut the services it provides even when it receives the same funding level as in the previous year. This isn't a political talking point. It is pure and simple mathematics. The report from the Center on Budget and Policy Priority measures the impact of inflation on the cost of government. By its calculation using the CBO baseline, real spending approved for FY 2011 to date is $34 billion lower than what was provided in FY 2010, a cut of $18 billion in real security spending and $16 billion in domestic spending. With this amendment, we'll be cutting domestic spending by another $6 billion, and in normal terms, but more than in inflation-adjusted dollars. Democrats have been chastised for only cutting $10 billion from FY 2010. Madam President, I would note that even in that comparison, which fails to take into account many fact-of-life increases, we should all understand that domestic spending is being cut by more than $14 billion, while security spending is slated to increase. Furthermore, Madam President, we are now halfway through the fiscal year. Agencies have spent an average of 50% of their funds. Each dollar we reduce at this time has the effect of doubling the cut made in programs for the rest of the year. Our subcommittee chairman recognized the difficulties that this level of spending will create for the programs he oversees. Accordingly, many of my colleagues on the Appropriations Committee are saying enough is enough, while those who are not familiar with the details of budgeting complain that we should be able to cut more spending. I would ask the Senate to consider one more measurement. For domestic discretionary spending, the total available for the whole year after the passage of this bill will be $400 billion. That's a lot of money. In FY 2010, we had $413.6 billion for these purposes. For nearly the entire first half of this year, we're spending funds at the rate of nearly $410 billion. And since the year is halfway over, approximately half of the $410 billion, or $205 billion, has already been allocated. In general, that means we only have approximately $195 billion to cover the cost of all the domestic agencies for the rest of the year. This rate of spending for the rest of this fiscal year is $23.6 billion below the rate we spent last year. And when we compound this, recognizing that inflation has increased the cost of operations for domestic programs by 16 years, $16 billion a year, we see that effectively for the remainder of the year, we will be asking our agency to operate at a rate of $39.6 billion below what we gave them for the same level of goods last year. In real terms, even under this short-term CR, we will be requiring our agencies to absorb more than 9% reduction in spending compared to a year ago. Madam President, agreeing to a cut of this size this late in the fiscal year will be most challenging for managements and agencies to manage. I believe our subcommittee chairman recognizes this reality, and it is why most of them are concerned that the level of cut we are agreeing to is already deeper than it is prudent. Finally, I want to point out to everyone who is listening exactly where we are and what we are really talking about in trying to conclude our negotiations on spending for this fiscal year. Those who talk about $3.7 trillion in spending and billions in unneeded funds are not dealing with the reality of this CR. What the decision comes down to is this. After this resolution passes, our domestic agencies will have approximately $195 billion to meet all their needs through the end of the year. This will cover the salaries of people who monitor our food supplies, of our air traffic controllers who keep U.S. airspace safe, our customs officials and U.S. Marshals who monitor our borders. It includes the cost of all our programs to support education from kindergarten to college, of those who ensure that our Social Security benefits are paid, and thousands of other activities. We have reduced their funding effectively by 10%. How much more of this $195 billion, which accounts for only about 5% of the $3.7 trillion budget, how much more of this spending can we really afford to cut before we are required to lay off food inspectors and shut down our meat plants? How much more can we cut before we have no funds to pay employees to monitor our borders and ports? How much more before we have to cancel the construction of dams and bridges and highways, sewers and transit projects, and throw thousands of private sector workers on the street? Madam President, it shouldn't be forgotten that when we force either civil servants or private sector workers out of their jobs, they both add to the unemployment rolls. They won't be paying taxes any longer, but they will tax already stretched social services. Surely we can agree cutting jobs, whether public or private, is not the right approach to assist our slowly rebounding economy. This is not a question of how much we can or should save from a $3.7 trillion budget. but a question of how much more our colleagues think we should cut from the $195 billion we have left to pay for our domestic agencies, when we will effectively be asking the agencies to cut another 10% over the next 6 months. Madam President, in the coming days, as we try to resolve our differences on domestic spending for the rest of this fiscal year, I hope my colleagues will keep some of these points in mind. Madam President, having said that, I intend to support this CR because it will provide the funding level that the White House has endorsed, and because if it fails, we would likely have to shut down the government. And that, Madam President, is unacceptable. So I encourage all of my colleagues, those who think we have cut too much and those who don't, to support this 3-week extension to allow our colleagues additional time to try and reach an overall compromise on discretionary spending for the rest of the fiscal year. I yield the floor. President, I suggest the absence of...
The clerk will call the roll.
Mr. Akaka.
The senator from Hawaii.
I ask unanimous consent that the quorum call be rescinded,
Without objection.
and I ask consent that time be allocated on both sides accordingly.
Without objection. The clerk will call the roll.
Mr. Akaka.
President.
The senator from Florida.
Madam President, I ask consent that the quorum call be lifted.
Without objection.
Madam President, I ask to speak as if in morning business.
Without objection.
Madam President, you remember a year ago before we passed the health care bill that everybody testified that Medicare was set to go into bankruptcy in 7 years. And you remember back then, just a year ago, Medicare paid doctors when seniors got sick, and Medicare was focused on the quantity of care instead of the quality of care. And back then, Medicare paid hospitals more if a patient got an infection that could have been avoided in the hospital, and they paid hospitals less if they avoided that infection in the first place, because Medicare, whatever the cost was, Medicare paid it. And remember back then that doctors would perform the same test over and over again for the same patient because they hadn't been encouraged in a law to work together and to share results. Madam President, that's why a year ago we passed the Health Care Reform Act, and now that act extends the life of Medicare by 12 more years until at least the year 2029. And now, as a change in that law, Medicare doesn't just care for you when you get sick. It's a more comprehensive health care system. Now, the senior citizens receive an annual wellness visit as part of the new Medicare law. They can receive screenings and tips on how to manage or prevent conditions like if they have diabetes or high blood pressure, and they don't have to wait until they get sick. And in my state of Florida, that's a lot of senior citizens. That's 3.2 million senior citizens. Another thing that this health reform law does is that it increases payments to hospitals for providing higher quality care. It gives hospitals the incentives to prevent avoidable illnesses. And the law improves the quality by increasing the number of primary care physicians. My opening statement was that hospitals were paid more if you got an infection in the hospital. We're now going to pay the hospital less. We're going to give the hospital an incentive not to have that kind of hospital that increases the infections while the patient is there. Well, now doctors under the new law can track the patient care. They can make sure that patients are seeing the right specialist, and they can help specialists avoid repeating the test and the procedures. There's a part that is just being implemented now in the health care bill called the Accountable Care Organization. Combined with that will be electronic records. So instead of Medicare beneficiary, the senior citizen going to this specialist, this specialist, this specialist, and this specialist, and all of them getting Medicare fee-for-service, now they're going to be under the umbrella of an accountable care organization that may be in the private sector. It may be part of Medicare Advantage in an insurance company that's managing the care for the Medicare recipient. Whatever it is, it's going to integrate with electronic records with the enhancement of primary care physicians so that all that duplication is not done and so that everybody's talking to everybody through the electronic records. And so these doctors now are going to be able to keep track of patient care, to see the right specialist, and to help the specialist avoid repeating the test. Now, you remember a year ago, Madam President, when the senior citizens had to pay a lot for their senior citizen prescriptions. Under Medicare, that meant that sometimes our seniors didn't get the treatment that they wanted because they could not afford it. Remember back then that Medicare covered the first $2,800 worth of prescription drugs, but then you didn't get any Medicare coverage of drugs until you had exceeded $6,300. And if you didn't have the money and you were a senior citizen, I'll tell you what was happening in that $3,000 to $4,000 gap. The senior citizen, like some of the senior citizens in my state and your state, Madam President, was they were doing without or they were cutting in half their prescription drugs, or they were unfortunately making the choice between food or their medicine. Something that in America in the 21st century you can't believe that's going on, but in fact it was, and unfortunately it still is, but it's about to go out because we are now covering that gap that is known as the donut hole in the new health care reform bill. And so this bill that was passed a year ago is closing the gap in that coverage, and in my state alone, that means that 235,000 Florida seniors received a check in this year of $250 that helped cover the cost of those prescriptions in that last year of 2010. And this year, in 2011, under the new law, the seniors who hit that gap called the donut hole are going to receive a discount of 50% off the cost of their prescriptions, and the gap under the new law is going to be entirely eliminated by the year 2020. It's going to be gradually phased in. A year ago, a lot of folks talked about the effect of health reform on Medicare Advantage. Remember that? Remember all of that criticism about how Medicare Advantage was going to go down and how it was going to get cut? Well, when we started proposing some real improvements to Medicare Advantage, a lot of the opponents were saying that it was going to kill the program. They said it was going to cut those benefits, and it scared a lot of our senior citizens. Well, the truth was that the insurance companies that provided Medicare, called Medicare Advantage, had a cushy extra 14% over Medicare prescription direct benefits. And Medicare fee-for-service plus 14% is what the insurance companies were getting. And those insurance companies pocketed much of that government extra spending, and we were not, under the old law, holding those insurance companies accountable for enough on quality. Well, as a result of health care reform bill, today that program is stronger than ever. Remember how they said it was going to get whacked and it was going to cause the seniors to go way down? Well, I can tell you in my state, enrollment is up 6% in Medicare Advantage, And the premiums are down in Florida by 9.6% on Medicare Advantage. And the new health care reform bill allows us to push back against the insurance companies who wanted to charge too much for Medicare Advantage. Just in my state, we were able to save Florida seniors $4 million in the form of extra health benefits or reduced out-of-pocket costs for their Medicare coverage. And now, under the new law, we're going to be able to reward Medicare Advantage plans, read Medicare insurance companies. We're going to be able to reward them for those that provide the quality plans, the high-quality care. Remember back a year ago what was happening on waste, fraud, and abuse in Medicare? The standards to prevent that waste, fraud, and abuse in Medicare were certainly not tough enough. How many times did we pick up the newspaper and we read about this guy had fleeced Medicare by opening up a storefront that was a fake storefront and just started billing Medicare right and left, and Medicare was paying it. And as a result, the criminals were able to rip off federal health care programs. And a lot of that was because there wasn't an adequate enough review. Well, this new law has enforcement officials with new tools to prevent fraud before it occurs. And this senator had a part, a little bitty part in that. And the law gives states money to conduct background checks on long-term care providers and to educate seniors on the fraud prevention on those people that prey on our senior citizens and take advantage of them. And my state has received a number of in excess of $3 million thus far in order to provide that education on fraud prevention. Because of the changes in this health care reform bill, Medicare is now stronger than ever. And as it is being implemented over the course of the next several years, it didn't take all effect at once. There's a lot of implementation in each year over about the next 4 years. And as it does, Medicare is going to be stronger than ever. And we certainly need to continue to protect and strengthen Medicare for all of our seniors. Mr. President, on the occasion of this year ago when this new law on health care reform became law, it is so complicated. And there are mistakes in it, and we'll correct those mistakes over time. That's the good part about this thing being implemented over the next several years, that where there is a mistake, it can be corrected. If this thing goes all the way up to the U.S. Supreme Court, which I expect it will, and if the court declares a part of it as unconstitutional, that doesn't mean the court's going to strike down the whole law. But there are plenty of opportunities where there needs to be corrections as it's being implemented that we can do that. But I wanted to come to the floor of the Senate and point out some of these things that have already strengthened the Medicare program as well as providing a more favorable environment in which to receive health care coverage, particularly for America's senior citizens. Mr. President, I yield the floor, and I would suggest the absence of a quorum.
Clerk will call the roll.
Mr. Akaka.
Senator from Ohio.
Thank you, Mr. President. I want to speak for a moment on I'm sorry, I want to note that
We're in a quorum call now.
Thank you, Mr. President. I ask unanimous consent to dispense with the quorum call.
Without objection.
Thank you, Mr. President. I want to speak for a moment about the continuing resolution and then speak on something else. It shouldn't really matter which political party you belong to. It's not right for any elected official to use the budget process to squander our economic potential and undermine our economic competitiveness. I see far too many people doing that in this debate. I also see that we are looking in a small window of the budget, something like 1/6 of the budget is where all the cuts are. This confining the discussion to that without looking at a millionaire's tax, without looking at closing loopholes. We know, the presiding officer knows, if a company in Wheeling or right across the river, Wheeling, West Virginia, or St. Clairsville, Ohio, if a company shuts down and moves to Mexico or China, they can actually deduct the cost of that move and that shutdown. That makes no sense. We need to close those tax loopholes. We need to look at the entire budget as we make these cuts. And, Mr. President, yesterday I was on the phone with the majority leader and talking to Ohio and Nevada media, and also with John Paul Hall, an Ohio veteran who is, after being discharged from the Army, was left homeless and turned to drug abuse. With the help of the Housing Urban Development Veterans Affairs supportive housing called HUD-VASH grant program, he's got an apartment. His life is on track. He's enrolled in college at Cuyahoga Community College in Northern Ohio, and he's on track to graduate and will be very employable. I mean, those are the kinds of cuts that Republicans have made to maternal health care programs, to Head Start, to programs like this for homeless vets. It's unconscionable that that's the approach they've taken instead of a much more serious long-term deficit reduction. We also know from what John McCain's chief economic advisor said that the Republican budget that came out of the House would result in 700,000 lost jobs this year because of their approach. And that's clearly not the way as this economic recovery has begun, not fast enough in West Virginia or Ohio or anywhere else in this country, but it's begun. So we don't want to undercut that. Mr. President, I ask unanimous consent to insert the rest of my remarks in a different place in the record.
Without objection.
I want to speak for, we were considering earlier this morning when I was presiding and through much of the morning the Small Business Innovative Research Bill, and Senator Landrieu and Senator Snowe were leading very well on that issue. I'd like to speak for a moment about another important issue for small businesses and workers everywhere, and that's our nation's trade and globalization agenda. As my colleagues are aware, the Generalized System of Preferences, the so-called GSP, the Andean trade preferences for Colombia and Ecuador, and the 2009 reforms to trade adjustment assistance all expired in mid-February. I don't think too many people are happy about that. I'm certainly not. I've offered amendments with Senator Casey and requested unanimous consent to pass both the Andean trade preferences and the trade adjustment assistance, but my colleagues, Republican colleagues, have objected. Others, like Senator McCain, requested a unanimous consent on only the Andean trade preferences, and I've objected. I've objected because we can't turn our back on American workers who lose their job through no fault of their own, only to then we help workers in other countries. Since Congress made reforms to the trade adjustment assistance in 2009, trade adjustment assistance has been with us since the Kennedy administration. It clearly works. When workers lose their jobs through no fault of their own, they get some assistance from the government to go back to school, to get retrained so they can be productive workers again. Again, they lost their jobs through no doing of their own. But since Congress made the reforms in 2009, 170,000 additional trade-impacted workers became eligible for training under the TAA for Workers program. So, Mr. President, if somebody loses their job because of a trade agreement that we pass in this institution, trade agreements that I think were wrong-headed, NAFTA, CAFTA, PNTR with China, other kinds of trade agreements with Australia and Jordan and Panama and Peru. When workers lose their jobs because of these agreements, we at least owe it to them to help them with trade adjustment assistance. But since this program expired last month, we've shut out service workers, we've shut out manufacturing workers who lost their jobs to countries that we don't have a free trade agreement with. So we don't actually have a free trade agreement with China or India. We did something called PNTR with China. So if a worker in Dayton or Toledo or Findlay or Zanesville loses her job because of a trade agreement to China or to India, they're out of luck. They don't get TAA. I mean, how awful is that? Just because they worked at a plant where that plant that plant moved because of trade, moved to China, but they don't get any kind of assistance. It wasn't their fault. It shouldn't work that way. In addition, improvements to the health coverage tax credit program also expired. HCTC helps trade-affected workers purchase private health coverage to replace the employer-sponsored coverage they lost. Again, they lost their job because of a trade agreement. They can't afford health insurance because they don't have much money, and they get some tax credit from the government to help them be able to afford this health care. It's helped thousands of workers manage hospital costs and medication and necessary doctor's visits. Without it, not only do Americans lose their jobs, but they're at risk of losing their health insurance. They generally can't afford their health insurance, which also may lead them more likely to lose their home and suffer from foreclosure. TAA, trade adjustment, HCTC, health coverage tax credit, if both expired, they must be renewed regardless of whether this Congress considers or passes any new trade agreement. Ambassador Kirk, the U.S. trade representative, will soon be submitting the U.S.-Korea free trade agreement to Congress. I've expressed my concerns about this agreement. I'm concerned it will be a step backward for American manufacturing, especially in the auto industry. I'm concerned that low-wage Asian nations will use Korea as a platform to export auto parts and steel duty-free to the U.S. They'll come in from some country to Korea, maybe China, maybe India, maybe somewhere else, through Korea, and then get access to U.S. markets duty-free. These are serious concerns. This isn't theory. This is based on what's happened since passing other free trade agreements. Every time we pass a free trade agreement, the supporters of it say it's going to be more American jobs. Well, and we're going to close the trade deficit. It never is. It's always lost manufacturing jobs. In northern West Virginia and much of my state, we've seen that inflicted on families day after day after day, and it means a larger trade deficit. But, Mr. President, at least we'll have the time to debate and consider the Korea trade agreement. Unfortunately, several of my colleagues across the aisle don't even want to consider the Korea trade agreement unless it's packaged with the Colombia and Panama agreement. So on top of not extending trade adjustment assistance, on top of not extending the health care coverage tax credit, my Republican colleagues want to move on all three leftover Bush trade agreements, Korea, in Colombia and Panama. These trade deals will not be winners for American workers. We know that our exports increase with free trade agreements. We also know that our imports increase to a larger degree. So the first President Bush said that when we have a trade surplus or deficit of $1 billion, it translates into 13,000 jobs. So a $1 billion trade deficit is 13,000 lost jobs. A $1 billion trade surplus is 13,000 increased jobs. That's President Bush's numbers. And you can just do the math. We have trade deficits of hundreds and hundreds of billions of dollars in this country. And when production and jobs is offshored, the innovation's not far behind. All of us, and I know the presiding officer has gone through manufacturing plants. And what you see in a manufacturing plant is you see workers and engineers figuring out always how to innovate to make productivity, to increase productivity, to make production more efficient and less expensive. If we innovate in this country and invent in this country, and then we send those jobs overseas for production, we begin to lose the innovation edge, because over there, whether it's Mexico or China or India or Japan or anywhere else, when the production's done over there, then the innovation is also done on the shop floor over there. So while we brag about being the most inventive, innovative people on earth, which we are, the future doesn't necessarily look that way as we outsource so many of these jobs. We've seen how these free trade agreements give incentives to move production overseas. Instead of taking away those incentives to move production overseas, instead of giving incentives to American companies to manufacture here, we do the opposite of this by passing a Korea trade agreement or a Peru free trade agreement or NAFTA or CAFTA or any of those. Peru's President Garcia, get this, spoke to the U.S. Chamber of Commerce before signing the Peru Free Trade Agreement. He said, said to American businesses, he said, come and open your factories in my country so we can sell your own products back to the United States. Come sell your own products back to the United States. How's that good for American workers? How's that good for innovation? How's that good for American manufacturing? How's that good for American middle-class communities? It's become a business plan for far too many companies in this country. And think about this in the broad sweep of history, how often this has ever happened, where a business plan for a U.S. company is we invent something here, we then produce it in China, thousands and thousands and thousands of miles away, and then we ship it back to the United States, back to the home country. That's the business model for far too many companies. If they were to set up in China and sell into China and East Asia, that'd be one thing. But company after American company have gone abroad, done the production there, sold it back into the United States. So it's not providing the work for American workers that it should. Again, my colleagues are holding people who need retraining and adjustment hostage to another trade agreement. So they're saying if you don't pass Colombia and Panama and Korea, then we're not going to extend trade adjustment assistance. We're not going to extend the health care tax credit. Health coverage tax credit. Free trade's biggest supporters put so much stock into these free trade agreements, and they do so ignoring the elephant in the room. And I'm talking about our trade relationship with China. Congress approved China PNTR more than 10 years ago. We know what's happened. We've had literally $500 million a day in trade deficits with China. That means we buy $500 million a day more in products from China than we sell to products in China. That's what a trade deficit of $500 million a day means, that we actually are buying $500 million every single day more from China than we're selling to China. That is not the long-term sign of prosperity. That's not a long-term indicator of strengthening the middle class. And Mr. President, until we figure out where we're going on trade and put a halt to these trade agreements and look at what we need to do instead, we're going to continue to see the shrinking of the middle class. Last week, I'll close with this, Mr. President. Last week, an appeals court of the World Trade Organization made a horrendous decision in favor of China against our trade remedy laws. The WTO has again overreached beyond WTO laws and rules against our anti-dumping and countervailing duty laws. It's the only way. These laws have been the only way to protect ourselves and protect our economy and protect our communities and protect our workers and protect our small businesses. One of the last tools we have to defend against unfair trade law are these trade remedy laws. In the WTO, a bunch of bureaucrat trade lawyers are taking them away. The WTO risks its own legitimacy with a ruling like this one. I urge the Obama administration to respond aggressively to this decision. I urge my colleagues in the Senate to step back from this stalled trade agenda, step back from South Korea, step back from Panama, step back from Colombia. I urge my colleagues to examine instead what's in the best interest of American workers and businesses. We can find a balanced trade agenda that makes sense for our businesses, makes sense for our workers, makes sense for our communities. President, I yield the floor. I suggest the absence of the quorum.
Clerk will call the roll.
Mr. Akaka.
Senator